Okay. How are y'all doing this evening? Okay, we have 10 people on so far, Steph. And I guess we can start now. Thanks to everyone for joining this webinar. I'm Christina. I am the founder of Shine, and I really like to zone in on parent education and parent support, as well as supporting our little ones. But, all the paperwork and all those things, those are very important, and those are very costly in these days and times. So we have a presenter here named Stephanie. She is an autism mom just like us, and she has taken the time out to learn this subject and to help other parents defeat this mountain because it is a mountain. It's a lot of paperwork. It's a lot of information. We Sorry, y'all. Did y'all hear that? Let's put my computer on do not disturb. I don't even know if I know how to do that though. Okay. Okay. I don't even know what I was saying, but Stephanie, she has taken the time out to learn this topic to be able to help other parents learn it because the going rate for someone to do this application for you is like $1,600. And I don't think people just have that lying around because the whole point of Katie Beckett is to not spend money out of your pocket. Oh, I'm so sorry, y'all. So without further ado, we'll start our slideshow. Please take some notes, have some pen and paper. Oh, I'm sorry, Stephanie. I turned the mic on. Okay. Please have out your pen and paper because we're going through the first steps of this application. It's a long application, so you're going to have to be able to use your notes as a reference when you're going out to your providers and your care team to reference back to. Okay, and we'll start the slideshow. This is the Katie Beckett consultation webinar with Stephanie Carroll of Spectrum Village. Our mission statement at Shine is to support and honor individuals and children and their families on the autism spectrum by providing them with support, resources, and we provide inclusion and other opportunities that the children and the family needs to thrive because we want everybody to shine. I'm Christina. I'm the founder of Shine. The reason I started Shine was because I have twin 7-year-olds on the autism spectrum, and they have been excluded from things. They have been picked on, and it's just not, that doesn't feel good. So I just wanted to create a space where we are with people that appreciate us for who we are, and no matter what we do or how things look on the outside, it's okay because we're just enjoying the moment and enjoying life. These are my twins, Saint and Sage. They are the inspiration for Shine and the whole reason why it started. Why are you here today? You are here because you are either tired of paying copays out of pocket, or you can't afford copays out of pocket, or the insurance is just too much money, and it's all financially related. This is a disclaimer. We're not lawyers. We're not doctors. We're not giving you legal or medical advice. So consult with your child's pediatrician, consult with your lawyer. And Stephanie, I'll let you take it away.
All right. Thank you, Christina.
You're welcome.
So Christina mentioned her why and her inspiration. And I do apologize, y'all. My camera is is here, and then I have 3 different screens, so I may be looking different places. So Christina mentioned her why and her inspiration, and this is my inspiration. My son Cairo, who is 3 years old and living with autism and childhood apraxia of speech. And he has progressed so well due to intensive therapy, which we would not really be able to do financially without the help of Katie Beckett, honestly. So Shine became a part of my life during a moment when I was in a frenzy. My son was diagnosed with autism at about 17 months old. And there was a moment, and I'm sure we've all experienced that, where I thought that, what the heck, what's next? And I came across Shine after attending an Easter egg hunt and have been a part of the organization since. And Christina's doing a wonderful work for the autism community. And she's a bomb boss and just a boss. So I know that the mics are mute, but I'd like to know who I'm speaking with today. So feel free to type in the chat. I'd like to know like your name, what area you're in, and what are 2 strengths and qualities of your awesome kid? Did anybody type? I don't see any. Am I in the right messages?
What was the second question?
Oh, what are some qualities? Oh, so I'd like to know you could put your name in the chat if you'd want, what area you live, and what are 2 qualities or strengths of your awesome kiddo? So I'll share mine. So you all know I'm Stephanie. I live in the Decatur area, and my son is a great singer. You see his party machine mic. He loves songs. He loves music, and he's very cheerful. Christina, okay. Hey, Lakia. Douglasville, sports, and cool. Clayco, strengths, great memory, and energetic. That's awesome. Asia. All right. Thank you for sharing that. Next slide, please. So the reason why my husband Mitch and I, we have 2 young boys, aged 11 and 12, athletic and creative. Oh, wow. That is great. A future pilot. Okay. Maxwell is persistent and warm spirit, Fulton County. Okay. Love it. So thanks for sharing. So in partnership with Shine, we'll be doing a 3 series approach to Katie Beckett application process. It
4.
is 4. Excuse me, 4. So the Katie Beckett application process, which I'm sure some of you have heard, this can be very long and tedious, and unfortunately, I cannot cover everything during our time together now. But what my goal is for the webinar today is to review eligibility, what is needed to apply, coverage information, and I did take a short snippet of the initial part of the application, and so we can, look at that as if time permits. So next slide, please. So the Katie Beckett waiver is also known as TEFRA. It's used interchangeably. TEFRA stands for, I think, tax equity and fiscal accountability, something like that. But Katie Beckett dates back to the 1980s. A 3-year-old girl named Katie Beckett was in the hospital and was unable to go home after contracting a brain infection. She was in a coma, and when she came out, she was paralyzed and basically ventilator dependent, and her family reached the limits of what their private insurance would pay. So at that time, Medicaid did pick up the cost, but would only pay as long as the young girl lived in the hospital. So Katie Beckett's parents wanted their daughter to be home, but it was Medicare, not Medicaid. Medicare would only pay as long as the little girl was in the hospital. So the family advocated, they petitioned, they went to their lawmakers. And at the time, President Ronald Reagan heard about this family and ended up changing the Medicaid rules. So the government allowed states to have exceptions so that parents like the Becketts who made too much money to qualify for Medicaid would still be covered for their children who had high medical costs. So today, Katie Beckett is offered in a few states, mostly like some in the Midwest, Georgia being one, of course, but like Idaho, Nebraska, Nevada, place where nobody really lives, and our good old Georgia state. So essentially, the Katie Beckett program extends Medicaid benefits to children who would have only been eligible if they were institutionalized. But now, children 18 or younger who live at home and would not be eligible for Social Security or Medicaid because of their parents' income can have access to this Medicaid waiver program. Next slide, please. So this is always a big question. Who is eligible? So in order for your child to be eligible for Katie Beckett, aka TEFRA, as used interchangeable, they have to actually have all of these conditions met. So the first, the child needs to be under the age of 18 years old. The child needs to meet the criteria for disability. And per the federal government, like this criteria would be a physical or mental impairment that limits a child's life activities. So some diagnoses that would fit in this category would be like intellectual disability, hearing impairment, speech or language impairment or delay, visual impairments, blindness, autism, what else? Traumatic brain injuries. So these are the type of diagnoses that would be in accordance with the federal disability criteria. So, and years ago, when a child received a form of disability diagnosis or autism diagnosis, it was recommended that their parents send them to an institution for management of their care. So when a child meets an institutional level of care, what this means is that the child's needs require the level of care typically provided in a specialized institution, such as a hospital, nursing home, or facility for individuals with intellectual disabilities. So the institutional level of care is determined by the assessment of the child's medical needs. So healthcare professionals, your pediatrician, if your child has a psychiatrist, they would evaluate the child's medical conditions, treatment requirements, and daily care needs. It also is determined by care requirements. Does your child require intensive and continuous medical or skilled nursing care that goes beyond what you'd be able to take care of at home without additional support or nursing support? Does your child require or use medical equipment or therapies that are typically found in a specialized setting? So this would be like if your child is ventilator dependent or uses or has feeding tubes and or life support technologies. And regular interventions, meaning does your child have frequent medical interventions or monitoring that is usually provided in a hospital or similar institution? And support services, which may be mostly where families apply for, like myself, that the child needs various therapeutic services like PT, OT, speech, ABA, aquatic therapy. And so these therapeutic services, believe it or not, would have usually been offered or coordinated in an institutional environment. So based on all of these determinations that I mentioned, Katie Beckett requires your child's physician to complete a level of care form to see what your child's functional or medical needs are, whether it would be appropriate, whether they would be appropriate for a nursing facility care for medical needs or something called intermediate care facility, or ICF, which is its acronyms here. So some children need the help of the Katie Beckett waiver just for medical needs. That would be appropriate for a nursing facility. So that's the level of care they would satisfy. So in this scenario, for example, Medicaid, if a child needed like nursing facility or medical needs, if that was a level of care, Medicaid would approve, or Katie Beckett Medicaid would approve to cover like blood transfusion, nursing care, medical supplies. So if your child fits under this category, they would not need a developmental evaluation or psychological assessment. There's a high chance that they would be approved based on needed nursing facility care. If you have a child like mine, they may not have any severe medical needs, but require many expensive weekly therapies for a developmental delay, impairment, or intellectual disability. So for the purpose of the Katie Beckett program or application, this is called an intermediate care facility for intellectual disability, aka ICF ID. So this means that the child requires a high frequency of therapies to address their developmental delay or intellectual disability. And the parents prefer to provide that level of care while the child living at home, instead of a child living at an institutionalized facility. So most parents apply for the Katie Beckett for their child under this category. And you must have a developmental evaluation or psychological assessment within the past 3 years to prove that this is a level of care that your child needs. So the child must be able to be cared for at home. So this is where it's very important for having the physician who you will utilize to complete their portion of the form certify that despite your child being appropriate for an institutional level of care, either nursing care or ICF, that it is better for you and your family to provide care for the child in their home. And another eligibility requirement is the cost of Medicaid. The cost of Medicaid caring for your child at home does not exceed the cost it would be if the child was in an institution. So the going rate right now, when I last looked, if a child was institutionalized or in the hospital or in a rehab facility and Medicaid was covering them, the going rate is about $9,000 a month to $75,000 a month. So essentially, the government is saying thank you for saving us money, and thank you for taking care of your child at home. So that's why this program is really for wanting a child to be able to stay at home with their family and still receive the care. Next slide. There's more. So, okay. So I discussed about who's eligible. So you have to meet all those criteria. And what is needed I'm sorry, go back. I think I missed number 6. Did I mention that? Another criteria, which is very important, is the family cannot be eligible for SSI or regular Medicaid benefits. I'm going to post a calculator here in the chat. Here. Did it go through? Because this is kind of a gray area. Sometimes some people will ask me, I make this much, and this is a good calculator to essentially see if your family would be eligible for SSI, then you will not be eligible for Katie Beckett, because it's an income. You have to not be eligible for SSI or regular Medicaid in order to be eligible for Katie Beckett, since it is based on family's income. Thank you, Christina. Next page. Next slide, I mean. So what is needed to apply? So copy of the front and back of your health insurance card. So this would be for private insurance. So when applying for Katie Beckett, I want to go back. So when applying for Katie Beckett, one of the most important things is to begin gathering documents. I will spend some time of these 2 slides. The process will take a lot of time, a lot of energy, and a lot of patience. It can actually take about 4 to 5 months to complete the entire application process. So definitely requires some time, energy, or patience, or you can pay somebody to do it. So, and then not, have to deal with all of it. So you will need a copy of your whatever private insurance your child is on, a copy of that, a copy of their Social Security card, birth certificate. The child must be a citizen or naturalized in order to be eligible for Katie Beckett. And then, like I said, you cannot be eligible for SSI. So they do require a current proof of SSI ineligibility, which can be proven in the form of either a denial letter from SSI that's dated within 90 days on when you're going to apply, or 2 months worth of pay stubs for whoever is in your household, or last year's tax return. For someone who may be like a 1099 or contract or self-employed, there is an area on the application where it's kind of like by honesty system. You write, what your wages and earnings are. But a parent's income, I'm reiterating this, a parent's income have to be over a certain amount, so they won't qualify for SSI. If you qualify for SSI, then most likely you are eligible for Medicaid, so you would not be eligible for Katie Beckett. It's all in the same kind of like pot, the same government money pot, but different names. And so copy of medical records. So 12 months worth of medical records. So this would be like your pediatrician records, specialists. Do they see neurology, ENT, test results? Did you do a genetic screening, lab results, ER visits, hospital visits, list of medications or herbal supplements that were prescribed? So all of these, let me scroll down. I can't see. Oh, my screen disappeared. Do you still see your screen? Your screen disappeared, Christina. Hold on 1 second.
Mine disappeared?
On my screen, but maybe I may have kicked something. Okay, I see it now. So school notes, school therapy notes, private therapy notes, that has to be dated within 90 days of whenever you're going to actually submit the application. So therapy notes, like ABA, OT, PT, speech, aquatic therapy, those need to be signed by the therapist and dated within 90-day time frame from whenever you're going to submit it. Things like evaluation and care plans that your child may do with the therapist initially, that can be within the past year. But keep in mind that you will end up requesting therapy notes twice in this process. The first time will be now, if you're planning to apply for Katie Beckett within the next 30 days. And the next one will probably most likely be within the 3 months, month 3, so that you can have all the records and it's dated within that 90-day. They're very particular about the 90-day time frame when dealing with the therapy notes. Next slide, please. It continues. Okay, so this is also what's needed. So copy if your child was in the hospital, discharge summary in the past year, those will be needed. Proof of child's income and assets. So on the application, it also asks, does a child have any assets? So you would list or gather any copies of any asset your child may have. So these are like bank accounts, savings, life insurance, or income like child support. This is what they're asking for. But honestly, if your child makes or has a certain amount of money in their name, they can be disqualified from Katie Beckett. And I believe the limit is $2,000 now. So if your child has over $2,000 in any of these, and let's say grandma has a savings account for them, and it's in their name, and it's $2,002, they can be disqualified from Katie Beckett. But accounts like 529 plans, college savings, the college 529, stable account, or special needs trust are exempt from this limit. So when we were doing it for my son, we did a special needs trust, and I would definitely recommend speaking with an attorney about establishing a trust. And I can post one in the chat if anyone's interested, because if your child has money and in their name, they will be disqualified if it's over $2,000. Copy of IEP. If a child is 3 years or older and has been evaluated in a school system, they'll have IEP. But if they're 3 and younger, they'll have a ISFP, Individualized Service Family Plan, I think it stands for. And it needs to be a current official version and not a draft. A developmental assessment. So as I mentioned prior, if a child only needs nursing care, or is eligible, level of care is nursing facility, and not a intellectual or developmental delay, they do not need a developmental or psychological evaluation. But if their level of care is more intermediate facility, they will need a developmental assessment if they're under 6, or a psychological evaluation if the child is 6 and older. It is a requirement. Can't go around this. The assessment will need to be within the past 3 years. And as your child is on Katie Beckett, it needs to be renewed every 3 years. And the assessment is required. Again, I'm saying that many times. And especially if your child has a diagnosis of autism, any developmental delay, cerebral palsy, Down syndrome, epilepsy, anything related to this. I would like to mention this because this has been kind of like a myth about 5 therapies. So in the past, a child could qualify for Katie Beckett if they had a prescription of care for 5 therapies, or we're doing 5 sessions of therapies a week, but that is no longer the case. The updated requirements for Katie Beckett waiver has changed to focus on these assessments. So in addition to therapies, these developmental assessment is needed. And in fact, I'm going to copy and paste the minimum requirements for these test scores based on these assessments. So autism alone and therapies or ABA daily will no longer be efficient enough to get approval for Katie Beckett. Let me paste it here so you guys can see. So when the psychologist or developmental pediatrician who does the evaluation, they'll have testing scores in there, and your child must meet one of these testing scores, at least one. And who can do the evaluation? This is a question I get as well, because BCBAs will not be able to give the evaluation. They won't accept it. It would have to be a developmental pediatrician, PhD psychologist, or that even school psychologists. Let me see. I have a little snippet of who is accepted. I wrote it down. I'll paste it. Let's see. Okay, so this is the qualifications that Katie Beckett accept for the person who would be doing the testing on your child. Next slide, please. What does Katie Beckett cover? Katie Beckett is literally, Katie Beckett is described as the payer of last resort. So what that means is your child has private insurance through whoever, mom or dad or whoever, and Katie Beckett would be your child's secondary insurance. So they will pay, Katie Beckett pays for deductibles, it pays for co-pays, co-insurance, prescriptions, therapies, doctor visits, transportation to appointments, hospital stays, what else? Incontinence products, dental, vision, durable medical equipment. In fact, it actually approved my son's cubby bed that we got. Augmentative communication devices, so AAC or PECS modalities. The stipulation is that the healthcare provider or the entity, they must accept, and I put in parentheses, straight Medicaid. That's the term that healthcare facilities or providers know the Katie Beckett as. So if you go into the doctor and say, "Do you accept Katie Beckett?" they would not know what that meant. That really meant. But if you say, "Do you accept straight Medicaid?" then you know that they would accept your Katie Beckett once you're approved. Katie Beckett also, I learned from a parent whose child falls under kind of like the nursing care, has nursing care. They covered her child's respite and nursing care for an in-home nurse to come assist them. So it does pay for a lot. You lose money by not applying, basically. All right. Oh yeah, pull-ups. Yep. That's what they cover, a lot of stuff. And I was very shocked, but they covered the cubby bed, and we pay, and cubby bed's about $10,000, and we paid $0. It said on the invoice, it said 0.00. I was like, oh, thank you, God. Okay. Oh, thanks for that. So this is one of 4 parts of the application. So there are about 4 parts of the applications to complete to make the full packet. So I'm going to review the general Medicaid or Katie Beckett application. I do suggest that when you begin completing the forms or giving your doctors the form, the parts for them to complete, do not date the forms until you have everything together, because it's valid for 90 days. So 90 days is the kind of the magic number here with Katie Beckett. Everything needs to be 90. So wait until you have everything together before signing. Even like when requesting form from your doctor or prescription, ask them not to date it. They can sign it, but ask them not to date it. So hopefully you can see this. Let me see if I can possibly share the Katie, the website, so that you can get the form if you don't have it. So the website I just pasted in the chat, that's actually where the forms are located. And the form I'm working from is the Medicaid application, Form 94. So it's basically demographic information. On the top, it'll say child under 19. You would select that, and then you would have to write TEFRA / Katie Beckett. There's no option to write that, so you would have to put that. So basic information, name, and you're completing the application as if you are the child. So your child's name, your child's information will be here, and you can take a picture of this if you'd like. I just filled it in, so it gives you like the overview of how it would look. So that's page 1, and next page whenever you're ready, Christina. Okay. So this is page 2 of the Medicaid application. So again, this is as if you're the child. And this is asking in the household, who is applying for Medicaid? You list everybody in the household, even if you have other children, you list everyone here, but the first name should be the child who you're applying for the Katie Beckett program for. And I put that there, and then, whoever else is in the family. So Katie Beckett, I don't know if you can see on the bottom where I have like the fake insurance stuff. So it asks for, your private insurance information, and Katie Beckett does back pay 90 days. So if you're approved today, for example, it will actually go back and pay your providers or your therapist up to 3 months before you were approved. So you actually get a check back from those providers. Next page, please. So I was mentioning about the wages. So this is page 3 of the Medicaid application. So if you have an SSI denial letter, or if you're proven SSI ineligibility by pay stubs, then you can just put C attached for proof of SSI ineligibility. If your child has no assets, then you would just put Katie Beckett application, child doesn't have any income or assets, which is what I would really encourage you to put. If your child has anything over, I think you just should, if you can, just take it out their name while you're applying for this, or put it in a trust. That would be the best way to improve your chances of approval. You can attach your pay stub, or you can actually just write out how much you make here. Let's see if anything else I want to point out. That's it. And then the 4th page of the Medicaid application is just like you validating your information, and you can register to vote if you want to or not. If you're already registered, you could just put like what I put not applicable, already registered. So this would complete step 1 of many of your application. Okay, next page, please. So a complete application for Katie Beckett from start to finish would include the form we just went over, the Form 94, the Katie Beckett Medicaid application, and then all of these other forms, which we will go over at our next webinar. We don't have the time to go over each, but 3 of the 7 of these forms must be completed by your child's physician. MD or DO is the only clinicians that will be able to complete these forms. The Katie Beckett will not accept from a PA or nurse practitioner. So it is a complete packet. So in addition to these, also you would attach whatever records you've obtained as well. So the application packet can be a minimum about 350 pages minimum. All right. Oh, thank you. So Katie Beckett literally opens doors. So if your child is approved for Katie Beckett, they will be eligible for the HIP program. And I don't remember what it stands for, but what HIP program does, it pays for, once a child is approved for Katie Beckett, it'll pay for the private insurance premiums. So if your insurance premium is $600 a month, the HIP will pay for that. We'll give you a check. But you must be approved for Katie Beckett program. I think it stands for HIP Insurance Premium Payment Program. WIC, if your child is under 5 and has Katie Beckett or in a Katie Beckett program, they're eligible for WIC, and also free lunch. If you're denied Katie Beckett, there is a program called Champions for Children that also gives money funding for therapies, but you must be denied Katie Beckett before you can apply for that program. There was a question someone asked about what happens after age 18, or what program would your child be eligible after age 18? And that would be the now comp waiver. This is also a Medicaid waiver program, and it's to support children with developmental disabilities. Well, there'll be adults then, but adults with developmental disability. So it's kind of like you transition out of Katie Beckett into the now comp program. All right. And if your child is denied, there is a due diligence process. You can appeal. Appeal usually will require a lawyer. But let's say you were denied because the level of care wasn't sufficient enough, and something medically changes or functionally changes for your child, you can reapply without having to appeal. You just reapply and do another level of care. So to summarize, utilizing your care team is very important. When you decide to start applying for Katie Beckett, make sure you let the therapist, the ABA program, the BCBA, your physician, your pediatrician, know that you're doing this so that they can ensure that their notes are up to date, as well as it emphasizes your child's abilities. The developmental or psychological evaluations need to be within the past 3 years. It may take weeks, even months, to get school therapy records or private therapy records. So begin requesting it now. And then you're going to request it again, like at month 3, before you want to actually submit your application. Because these therapy notes, remember, have to be dated within 90 days time of when you submit it. And the physician forms that I think I mentioned, they must be completed by an MD or DO. So this would be completed by your developmental pediatrician if your child sees one, or your general pediatrician or psychiatrist, family practice if that's who your child sees for primary care. But they just have to have those qualifications. And last, I want you to be empowered. Initially, this seems very overwhelming, but if you're wanting to begin the process, follow the steps to start gathering your documents. Once you gather your documents, request your documents, then you can start doing the first 4 pages of the application, the demographic stuff. And then our next session, we'll actually look at the applications, the other applications. And I have a slide. Next slide, please. So I have a slide of some important sites. Some I've already copied and pasted in the group to check if you're eligible for SSI, Medicaid, and the Katie Beckett application packet. All right. Any questions? I wish we're going to type in the group, right?
You can unmute yourself if you want to ask a question, or you can type it in the chat. It doesn't matter.
Okay.
Asia has the first question. She said, are therapy notes essential? For example, we just removed my child from an ABA provider because of a bad experience, and we're currently looking for a new one. Therefore, we will not have notes. When you say dated, are you referring to the actual date a therapist makes a note?
When I say dated, I'm referring to the time that the child received that therapy. So if, for example, if the child received the therapy July 1st, we would need from July 1st, and if you're going to start applying this month, for example, you would need from 3 months before up until the month of July. if you apply after, if you decide to apply in October, I don't know, in August, and you do not have any notes from 3 months prior, then you're going to need notes. You're going to need either to start ABA again, or and get another evaluation. So it could be within a year, but Katie Beckett does require the therapy notes to be within 90 days. I hope that answered the question. Okay. Are you just applying online, or have you worked with any state office? So
I think he's talking about you.
Oh, okay. For me personally, Jason, for my family, I just did it. It took me about 4 months, 4 to 5 months to sit down and do it. I believe that there are programs that offer assistance. There's a lot of personal information that you have to put down. So I personally just wanted to do it on my own. But there are people that are charging for the application to be done. And then, yes, you can go to a local state to possibly help you program. And I think TELIC made the organization called TELIC, TELIC. I believe they offered Katie Beckett assistance. Am I saying it right? TELIC Empowerment.
I never knew the pronunciation.
Oh, yeah. So,
but I will post a link in the chat.
Yeah, I believe they offer it as well. And
also, tell them about your success rate. Stephanie, she's not going to say this, but she also fills out the application for families.
But the in-home nursing program I work with is called GAP. If they charge under 21 or so, CSNP can be used for that. Okay, good to know. And Jason, in terms of applying online, the Katie Beckett application can be done on Gateway, but I do not recommend that. I recommend that it's literally done paper, and it's printed and brought to the office either in person or through a certified mail where you'll get tracking and all that. With Gateway, sometimes I don't know, it's very antiquated system, and you're doing all this work and getting all these applications and therapy notes and people signing stuff. It seems to work better for it to be hand delivered or mailed with signature.
Also, tell them about your success rate for filling out the applications for other families.
Oh, so I am just a lay person, but I have been helping other families. I do this for free. I have been helping other families with going through the process of the application. I'm not going to actually do the application for you, but I can, after you've gathered your things, I can review it and make sure it fits the eligibility requirements. And so far I've helped 10 families, and about 7 have heard back and have been approved for Katie Beckett. So yeah, that's my spiel that I don't really share. The office is in Norcross. Let's see what the address is. We had it. I think we. So there is a very nice administrative assistant that works in Norcross, and she literally takes it from your hand and gives you her name. And here's the address for the Katie Beckett application where it would be delivered. There's also an option to fax, but again, I don't know, that could be lost in translation. So they actually, when the application is completed, Katie Beckett actually takes the paper form and actually scans it into a database, and then it's reviewed by medical professionals.
Does anyone have any more questions?
Okay.
This webinar is also recorded for your convenience, so you didn't miss anything.
Jasmine, can you possibly can I message Jasmine my email so that we can coordinate and I go over it with her? Or she can listen to the or they can listen to the recording. But I would be happy to, like, go over it with you individually if you'd like. You can email Shine to get me. Please put your email in there.
Hi, good evening, Shine. I'm so sorry. I thought it was 9 p.m., but I totally missed the time. Please, how do I put in my email as well to get a recorded video?
Oh, I put in the email of Shine's email.
Yes.
You can email Shine. You can email info@shineautism.org to get the recording, or if you'd like to schedule a time to speak with me.
Yes, I'll definitely schedule a time. So how do I do that? How can I schedule?
Email info. I put it in. Can you see the chat? Sometime when you're on the phone.
Oh yes. Oh yes. Yes.
Oh, okay.
Okay.
Mary, can you put your email in the chat?
I see your email, Jasmine.
Okay.
I got you, Jasmine.
So
and everyone will be sent a recording of this webinar as well, so you can refer back to it.
So has anybody started the application process? Oh, my camera's off. My apologies. I didn't realize that.
It was off the whole time.
I
I thought you did that on purpose.
Oh, no.
No one started the application process yet? Okay.
Oh, it's your first time hearing of this. Yeah.
I haven't either. Like, I just heard about this last month when my daughter was denied as for the SSI benefits.
Okay, so she would be a candidate then. And you had that letter?
Yes, I have everything.
Okay, yeah. So yeah, we can talk offline.
Okay.
Definitely. And Jasmine said this is her first time hearing about this program. It is definitely beneficial. It's not shared much. The government does not want to give money out. So, but it's very helpful. There's a part of the application where you have an opportunity to put exactly how much a month that you're spending either through copays or copays, deductibles. And when we calculated ours, it was like $3,500 a month. And it also takes into account private therapies if you're paying out of pocket as well. And so as I mentioned in the webinar, Medicaid does not want to pay $9,000 and $75,000 a month for your child to be institutionalized. So the cost that you're paying out of pocket is always going to be, well, I don't know, maybe someone pays $9,000 a month for therapy. I have no idea. But your cost most likely will be less than what Medicaid would pay if your child was institutionalized. But they want that. With GAP is not well known. Do you have to apply for SSI first to get the denial letter? Yes, you have to apply for SSI first to get the denial letter, but you do not have to get SSI. You do not have to apply for SSI first in order to apply for Katie Beckett. You can utilize your pay stubs or like your last year's or 2023's income tax. That would be proof that you would meet that SSI eligibility.
Okay, please, I have a quick question, please. So, the reason why I was denied was based on income. So, I'm married, but my husband is not my daughter's father. So, but they use his income, household income, as one of the eligibility for her, but
Yes.
she wasn't eligible. So, what about this? I hope this is not going to affect it as well.
I can't hear.
Yeah, can you hear me?
You're asking if you could use your husband's income, but that's not her father.
Yes, I mean they used his income when I was applying for the SSI. That was why it was denied. But like I'm only working 15 hours a week, and that is nothing. So I don't know if this is the same process as the SSI.
Yes, Mary, it is actually. And because you already have an SSI denial letter, so you'll include that in your application. You do not have to submit pay stubs. But the income is based on the household, whoever lives in the house, and the application. I reviewed it in the beginning, but on the application it just asks for everybody who's in the house. But yes, you can use that denial letter, keep that handy, and you attach it with your application instead of the pay stubs, if that's, or you can do the pay stubs, whichever. It has to be one or the other.
Okay.
Do you need Katie Beckett to be eligible for now comp when the child turns 18? No, you do not need it. It would just be like, 18 years of or 15 years of not receiving money or support, but no, you do not need it. But I do believe, and Christina, correct me if I'm wrong, there is a wait list for the now comp waiver. Katie Beckett, there's no wait list because nobody knows about it, so not many people know about it. But the 18 and older, I believe there is a wait list of people actually start putting their kids on like when they're in elementary school or applying for it. Application in.
Sooner the better for the now comp. And if you're already applying for Katie Beckett and all that, or your child is in therapy, go ahead and apply for now comp now.
My child was in ABA and speech therapy for over a year, and we just heard about this last month. Wow, we were spending yep, it adds up. It's a lot of money. And the sweetest thing is when you get when you're approved, and Katie Beckett will back pay 3 months, and you get all that money back that you've paid out of pocket. So like $9,000 back you'll get, between the therapist giving, reimbursing you. So yeah. All righty.
Hello, can you hear me?
Yeah, hey, yes.
Hi. So quick question before we end the webinar. You mentioned that the back pay for like insurance premiums.
Oh,
did I get that right?
The back pay, it would be for the therapy costs. So the therapy co-pays, or let's say some speech therapists do not accept certain type of private insurance, and families may opt in to pay out of pocket. So let's say that's the case, and you're accepted for Katie Beckett. And if the speech therapist accepts Katie Beckett, you will be reimbursed for 3 months worth of payments that you've given that speech therapist, because they're able to now bill Katie Beckett for those 3 months, and they can't bill Katie Beckett and also you paying as well. That they would get in trouble for that. So that's what I mean. In terms of insurance with the HIP, once approved for Katie Beckett, you will be eligible for the HIP program, which would cover your insurance premiums. So whichever insurance premium the child is on, the private insurance premium.
So if I have private insurance, the premiums that I pay, for instance, out of my biweekly checks,
Yep.
and
They pay.
if I have multiple family members on there, it doesn't matter.
Doesn't matter. Nope. They pay for that premium. So if your premium is $600 a paycheck, $1,200 a month, you'll get reimbursed through the HIP program. I do. I'll mention this. We'll talk about this in the next session. But I do recommend when submitting your application packet to go ahead and submit the HIP form with the packet, even though they're different entities. What Katie Beckett office will do is when you're approved, they'll go ahead and send your form to HIP on your behalf. So that's something that I failed to put in the PowerPoint, but I do recommend putting the HIP application in the packet. Thank you. Be empowered to do it. You'll save so much money.
Okay, ladies and gentlemen, it is past 9 o'clock. I hope you got something out of this webinar. I know it's a long process and you have to get a lot of documentation, but if you start now, you'll be ready for part 2, and then we can go over in depth of how all the forms look and how it should look to increase your chances of being approved. And from there, we'll go to part 3 and then part 4. But Stephanie is gonna walk you through this process. She's gonna make sure you have the tools to be able to not have to keep spending all this money that you're spending, because like everyone said, Katie Beckett, this is a hidden gem. No one knows about it. So please take advantage of all of this information. The recording will be sent out by end of day today. So you can go rewatch it at your leisure, and make sure you are communicating with your care team. Like, start now. Tell them, hey, I need this, and that. Don't put a date on it. I need everything. School's about to start. So
Yeah.
everything's about to get busy. So just start now.
Yeah, if I can leave one advice, if you want to start within the next 60 days, go ahead and look at the slide that says what is needed to apply and start gathering those documents and saving it in a folder. Yeah, I would start from there, and then next month when we meet. Not next month. When is it? September? I don't remember the date. August, September.
September.
When we meet then hopefully you'll be able to have some of your documents, some of your medical records and or therapy records.
I put the registration for part 2 in the chat. I will also put, we can skip this part. I'm gonna go to, so you guys can see the flyer. For the next session, take a screenshot if you need to. Part 2 is strictly the physician forms, which is probably the biggest part, right, Steph?
Part 3 would be, because there's 3 forms for the physicians to sign. I kind of mentioned this to Christina before. Sometimes our medical professionals or medical professionals, they may not know all the strengths or abilities of your child. And it's very important to be empowered to let them know what the daily life of your child is, because they may not know, for example, that they're not potty trained, or they may not know that, they're feeding therapy, things that these forms mention, they may not know. So sometimes it's good to, leave them a note. Hey, as we look at the forms, you'll see what I mean. But leave them a note and say, hey, Johnny is still not potty trained, because that is one of the questions on one of the DMA forms, DMA 706 forms. So in other words, I would not just give them the paper, like give them here, fill it out. I would probably give them some information about your child, unless you have a pediatrician that knows your family very, very well and provides that more one-to-one concierge care.
And that's rare. All right. Thank you all for joining. Like I said earlier, the recording will be in your email by end of day today. Maybe Saturday morning as well, if it takes a little longer to upload to the cloud. So be on the lookout for that email. Thank you so much, Stephanie, for your expertise. You did it perfectly. And I'm glad you have touched some parents on this webinar today. And parents, good job for continuing your education to help your child, because that is the most important part. No one's going to come do this for you, and you're deciding to make your life easier and your child's life easier. And with that, we'll say good night to you all and see you later. See you on the next one.
All right. Take care, everyone.